Hello and welcome to another episode of De-Stress with me, Dr. Amanda. In this podcast, I aim to highlight the often underestimated impacts that stress can have on our bodies and our lives. I sit down with experts and people from everyday life to get to know a bit more about stress, learning about their own experiences and knowledge, and giving you practical tips that you can use in your everyday life to manage stress. Now, today's episode, I'm really excited to share with you. We're on episode 7, so if it's the first time that you're tuning in, welcome. There have been 6 more episodes with some really great conversations, from massage to managing your menstrual cycle to therapy, and I even sat down one of the episodes with my husband and spoke about marriage as well. So yes, I hope you do enjoy and I hope that you stay along. Please subscribe if you haven't already. And today's episode, we have yet again another amazing guest, and I sit down with Leeanne Adu, who is a mother, a wife, she's also a business owner, but today we spoke about her story with stress in terms of her diagnosis with breast cancer. Many of us will go through health experiences where really our lives become at risk, and that in itself is unexpected, often unavoidable for some people, and is a really stressful thing to go through. But she says now she has gone through her treatment. She's currently has no evidence of disease, and she's talking about how she's kind of navigated through that journey, and now on the other side of it, how she's trying to live her best life. It was a great conversation, and so please stay tuned for the rest. Hi, Leeanne. Thank you so much for joining me on the podcast today. I'm so excited to have you on. Do you mind introducing yourself to the listeners, to the watchers, and then we'll get into the conversation?
Amazing. Well, thank you so much for having me. I'm really, really excited to be here. I'm Leeanne. I am a 38-year-old business owner, mother from Southeast London. I run a business which is a remote PA support agency. And coming up 3 years ago now, I was diagnosed with triple negative breast cancer. So at the end of 2020, I found a lump and was diagnosed with breast cancer, and then went on to have sort of half a year of treatment before then starting to heal and come out of it on the other side.
Brilliant. And this is the thing, this is exactly why I wanted to have you onto the podcast. So again, thank you so much. Basically, I found you on Instagram. I was following the Black Moms Up Front account, and I think I'm pretty sure you took over the Instagram stories or something. And it was from there that I started following you. And it was at the point when you were during your cancer treatment is when I started following you. And I was just so inspired, impressed, just of how you carried yourself through it all, and how much you shared and how vulnerable you were. And then seeing, you now in this phase out, after that journey or after that phase and into this, really flourishing, and seeing you out there. Like I saw you on IT. Is it Good Morning?
This morning, yeah.
This morning. I saw you on This Morning. I've seen your campaigns in your lingerie, and I was just like, it's really amazing. I see you with your daughter as well. And I just wanted to get you on here to talk about, when there are we all have different phases or periods in life that make us stop and reflect on things. And on this podcast, we talk about stress. So we talk about the impact that stress has, but also about how we can live through stress, because you can't really avoid it. But because if you're living life, if you're evolving and everything, stress will come along. But it's about how do you manage it and how do you thrive through that? Mm-hmm. And looking at you, it seems that you are thriving, and not to say that there aren't difficult parts, but it does seem that you are thriving. And one of the most stressful things that an individual can go through is when their health starts to become more vulnerable and starts to be questioned. And so going through a massive diagnosis, like having breast cancer, not just breast cancer, that triple negative, and for that to happen in your 30s with a young family, I can't personally imagine what that's like. I've gone through the journey with patients, but I wanted to speak to you so you could share what that journey's been like. I know there's a lot of people that will resonate with your story, and kind of how you managed through that stress and what it's like now on the other side. So with
Mm.
all that said, I'm gonna be quite a bit quieter now and let you tell your story. Like, yeah,
Yeah.
what was happening at the time?
Yeah. So, I'll go back a little bit further before the cancer diagnosis and the things that were happening in the world at the time. And I started my business in after the birth of my daughter, so summer 2018. And after the birth of my daughter, I was very, very unwell with postnatal depression, had a terrible, very traumatic birth with her. And healing from that left me in a really kind of vulnerable place. I decided that I couldn't go back into the workforce. I couldn't go back into an office. I'd been a PA for since I was a teenager. I was absolutely, that's my career, my job. I loved it, but I was
Hmm.
really tired, exhausted of working in environments that didn't nurture me, that didn't support me, that didn't put my welfare first. And,
Hmm.
let's be real, that's most organizations. It's rare to find an organization that really wholeheartedly supports its staff through difficult times. And
Absolutely.
so once Tiana was born, I'd made that decision that I wasn't going to go back into an office environment unless I really had to. So I set up the business on the side. And I did get a part-time job, but I really took a step back from being a PA where I was doing three different jobs, really stressed out, really anxious, to a job that was not to do it any disservice, it was an important job, but it was really basic for me. I could do it with my eyes shut. It was essentially a secretarial role where I spent the day typing and making teas. And that really
Hmm.
suited me because it allowed me to, one, build my business on the side, but two, not have the worry of taking work home, not have the worry of me shutting my laptop at 5 o'clock and someone judging me. It meant I could just come and go as I needed to, get the job done, go home, spend time with my baby, which was the thing that I craved. So I set the business up on the side. And about a year later, it got to the point where I knew I had to make a decision, business or stay in an office job. And I chose the
Yes.
business.
Amazing.
So left that job towards the end of 2019 and said, okay, I'll give myself 4 months. I was terrified. I give myself 4 months. I'll give
Mm.
myself until February 2020. And if it doesn't work, then I'll go back into the office. Fortunately, it did work. And come sort of spring 2020, the business was really thriving. But then the pandemic hit. And that
Hmm.
was a massive source of stress for, the whole world.
Yes.
Um, at the time, my husband was laid off work, so we just had one income coming in. We had some savings, but it was really a very, very scary time. And it was around that time I started noticing some things about my body that weren't quite right. So I'd
Okay.
had an ear infection that just seemed to linger. And I got
Hmm.
really sensitive to sound, very, very sensitive to sound. So if someone was behind me making noise, it was like they were inside my brain. And I kept going back
Okay.
to the doctors, and eventually they said I had tinnitus and vertigo and things like that. I thought I was going mad. The ringing was constant, the
Hmm.
sensitivity to sound was constant. And I got a referral, but of course we were in a pandemic. It took months and months and months for
Yeah.
anything to happen. And they were just like, you've just got to live with it. Meanwhile, constant whooshing in my ears, constant ringing, and just feeling very, very uh, not like myself. And I remember talking to clients and crying to clients because I just
Mm.
couldn't understand why I couldn't focus, and it felt like I was doing a really, really bad job. And the reason I say all this is because although there's no basis for it, I do believe that that was my body giving me warning signs that there was actually
Hmm.
something more serious going on. Um, so we go through the year, business is great, everything's great. I'm learning to manage the ring in and all of that kind of stuff.
Hmm.
And we get to October, and it feels like the world's getting to a place of stability, maybe.
Yes.
And
I
I
remember that.
just started taking the last Wednesday of the month off because running your own business is just full on constantly.
Hmm.
So I decided that because I felt so tired, so burnt out, I was going to take the last Wednesday of the month off work, just a day for myself. My daughter would be in school, husband at work. I could do whatever I want: sleep, eat, go out.
Yeah.
And so it was on one of those Wednesdays, the last Wednesday in October, that I woke up, rolled over in my bed, gave myself a hug, and found a lump under my armpit, just sort of side of my breast towards my armpit. And the
Hmm.
one thing that I am is very, very body aware. Like I know I could tell you what side I'm ovulating on. I could tell you so many things about
Okay.
my body.
Hmm.
So this lump was new to me and was not common, was not normal, was not my normal.
Yes.
So I remember messaging my best friend and telling her, and also my mum, and I've still got screenshots of those messages, saying, "Oh, I found a little lump." And they were like, "Well, if it was us, what would you tell us to do?" I was like, "Okay, I'll
Yeah.
make a doctor's appointment." And I was really fortunate. I gave it a couple of days, but it was playing on my mind. So I called the doctor. Fortunate that I got a sympathetic doctor on the phone, because again, we couldn't go into the GP surgeons at that point, who said, "Listen to me," and then said, "Right, come in and we'll get a doctor to look at you." Went in again, saw a fantastic GP who was very much kind of not concerned. She did feel the lump. She didn't, if she did have concerns, she didn't express them. She was, "You're very young." I was 35 at the time. "You're young, you're healthy, presenting healthy." But she did say that her threshold for sending people was like, she would send people because better safe than sorry.
Absolutely. Yeah. Have a
And
low threshold.
and I'm super grateful for that, because I could have got a different doctor who would have been like, "No, it's fine," and sent me away. So went on the 2-week pathway to the breast clinic. I got in at my local hospital, which was like severe PTSD, because it's where I gave birth to my daughter and just had that terrible experience. So that in itself was just like, what? But straight away, she did an ultrasound, did an examination, sent me for an ultrasound, and then a mammogram, and then they decided to do a biopsy. And she said, "We're not worried about the right one." I said, "Oh, we're not worried about the left one either, are we?" And she just sort of looked at me. And that day, I was in there for hours, but it was so invasive because they just rushed through it. And I remember coming out feeling really violated, because I'd had to have this biopsy and I'm on my own, and they're not really, there's a problem, but they're not really kind of explaining what's going on. And then they send you on your way, and they're like, "You'll get the results in a few days." 3 weeks later, I still haven't got my results. And at this point, I am in bits. I am just in, and I think I'd got to this point where I'd resigned myself. The reason I didn't have my results was lots of failings. What happened at my local hospital is they do the testing there, but they all send it to a different hospital. They send it to Guy's, and Guy's then do all the other stuff. So somewhere, it took a long time for them to send it to Guy's, essentially. And I was calling and calling the hospital, and they were like, "I can't tell you anything. It hasn't gone to the MDT yet," which is the multidisciplinary sort of team meeting. Where they discuss all the cases. But the words that I'm hearing are telling me that this isn't nothing. So I resigned myself to the fact it was something. But I remember just on my floor, just crying, like wailing, because I just knew it was the weight, but it was also the weight knowing that there was something wrong here. Like they don't, Eventually, I managed to get hold of someone at Guy's. They were like, "Right, we're discussing it on Friday." She said, "We're discussing it on Tuesday. I'm going to make you an appointment for Friday." I said, "Do I need to bring someone when you're not allowed to bring anyone to the hospital?" She's like, "That's probably a good idea." It's like, okay. So she had my best friend with me. Go on.
Honestly, I'm just, as you're talking now about this bit, like the hairs are standing off my arms. Because I can just imagine that. I've been in the breast clinic from the other side. And it is a bit of you are rushing people through. It's kind of like, okay, here's your consultation, go through and have your ultrasound, go through, have a mammogram, come back, let's have a little chat, get your biopsy, and you'll get your results. But then to have that day, to do that alone in a pandemic world, after all the, oh gosh, just to go through all that and then have to have that weight. And everything that you're getting back is telling you that there's something wrong, but you don't know what it is yet. I can just feel the weight of that, how difficult that would have been. And it was just something you said at the start. I'm very grateful that you shared that context, because I think a lot of that first part of your story really will resonate with a lot of people, because it resonated with me, that you had your birth, you had your daughter, you had a difficult birth. That was one thing, but also having a child kind of flips everything. And finding yourself wanting to have more autonomy of your time and to be in a safer space and creating that space for yourself. That's exactly like that's kind of the position that I'm in right now, trying to create this safer space for myself. And but it's just the fact that you had gone through that stress of having your child, gone through the stress of stepping out and creating your own business. And it sounds like you were very proactive about it. Like you you were making all these changes to live a life that was more in line with where you want it to, and then this comes along. But yeah,
Yeah.
sometimes you can do everything for yourself. You can advocate for yourself. You can know your body. You can, you know, change your whole career to be there for your family, and things can still happen. And that's why
Yeah.
we can't avoid the stress. But you're very intentional, I can already tell. But yeah, I just wanted to just pause there because there were just so many things that you're bringing up. I was like, I just need to touch on them.
Yeah. No,
But yeah,
amazing.
but carry on.
So found that lump in October, and then I got my results on the 4th of December. So that was the gap between. That's I think it was about a 6-7 week wait
That's
for
a long gap.
really long gap. And it was 2 days before my daughter's birthday as well. And so went with my best friend. You know, you've got those people who are like, this is the person that is going to be with me. It would either be my mum or Charlene. And Charlene came with me. And we just sat there making inappropriate jokes in the waiting room, doing what we do when we're in stressful situations. And we get into the room and the doctor says it. He says it's a little bit of cancer, aggressive, small. We've caught it early. Whilst I don't think he was lying, stage 3 is not early. Stage 3 is
Yeah.
you know, we're
And a
getting there,
little bit
guys.
of cancer.
Yeah,
That's
exactly. Really minimized it, which actually probably was a blessing, because if I at that point had realized how serious triple negative, all breast cancer is serious, but triple negative in
yes.
particular, there aren't many treatment options. And for people that don't know, triple negative means that there's no hormone involvement. It means that the hormone therapies that they can use to treat breast cancer, hormone positive breast cancers, aren't available. All they can do is surgery, chemo, and radiotherapy. So the choices are very limited. It's also very fast growing. It affects younger women. It affects Black women. So I was hitting all these trigger points, boom, 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 boom. But he kind of said this, and we just held each other's hands very tightly. And then I let out this huge roar, because I was just like, it's either roar or vomit, and I chose the roaring. And that was the moment that everything changed. You know, I knew I had breast cancer. In my heart of hearts, I knew it. But to hear those words was just shattering. And actually, all I could really think about was, one, am I going to die? And two, you know, how do I tell my mum, my husband, my sister? How do I tell these people? My mum was waiting for us outside the hospital. She knew as well. I was very honest. I was very honest with those close to me. I was like, I've got cancer. Like, no, you can't say that. I was like, no, come on, guys, we need to get used to the fact I've got cancer. So she was there, and then we went for lunch, and it was all like, well, let's read all these leaflets. We were right before Christmas, so my treatment started just after Christmas, and I had 20 weeks of chemo. Then I had surgery, which was a lumpectomy and lymph node removal. The cancer had spread locally, so it was in my armpit. They found cancer in every single one of my lymph nodes. I think they took out like 28 or something, and there was scarring in all of them. And then I had radiotherapy. Continued working throughout my treatment. I only took Wednesdays off, and I think part of that was a bit of a coping mechanism. If I can just keep going, and you know, I still need to make money. I don't have the luxury of sick pay. I don't have the luxury. You know, those are the things that I gave up.
Yes, because you've just started your business.
Yeah, and just before I got diagnosed, I was looking at like health insurance and pensions and wills and all of that lot. And the thing is, when you get diagnosed with cancer, no one really wants to give you health insurance, not for like loads of money. I'm not going to get loads and loads of insurances. So we had to put all of that on hold. The one thing that I did do was make my will very, very quickly, made my will. The thing about cancer and the thing about life-changing illnesses and diseases is all that control that I had sought had been stripped away. I was living in the hospital. I was there, you know, several times a week. You don't just go in for chemo. You have to go for blood tests. You have to go for checkups. You have to go for consultations. Anytime I felt unwell, they'd get you in to look at you. It becomes almost a full-time job. And so, you know, doing practical things like making a will and trying to make sure that everything around me was working well, that the business was working well, helped me still feel in control.
Yeah, of course. And that's like you said, there isn't another option really, because the other option is to not engage and what happens there. And so I completely understand why it was a good coping mechanism or something for you to do to have those things in place, because
Mm,
it sounds so all encompassing. You know, any little twinge, you want to go and get it checked. You know, the way that the chemotherapy makes you feel, the
mm,
appointments you have for the radiotherapy, the surgery, the recovery from that, and also the after effects of surgery. Like, I know taking your lymph nodes out, a lot of these things, you remove something from your body that has a function, and so
yeah,
there's an impact when they leave.
yeah,
And so having to deal with that all and like having those reminders,
yeah,
it must be good to have something where you can detach from it a little bit. And some people may say that having distractions isn't always best, but I think it's really important when you're having something that's, you're not ignoring it, but you need moments of just
mm,
like of freedom from it, and
yeah.
maybe, you know, working on with your clients and on their schedule they've got going on, and you know, sorting out the business. When you've got something else big like that on your mind, it kind of
Yeah.
releases you slightly.
Yeah, it does give you something else to think about. And I found myself really falling into this routine because the chemo was so harsh. And the chemo that I had, the first one I had weekly for 8 weeks. It was called Paxlotaxel and carboplatin. And it some people say it's the easy one. You know, none of it's easy. Everyone responds
Mm-hmm.
very differently. For me, it gave me uncontrollable nausea. You know, there were the I lost my hair, I lost every single hair on my body. I
Yeah.
gained 3 stone from the steroids, but the hardest part of that for me was the nausea, the constant
Mm-hmm.
nausea. They would change my meds, they would do lots of things, but it was just constant. And so, although I took Wednesdays off, I found myself getting into this little routine. So, Wednesdays was chemo day.
Yeah.
Thursdays, Fridays, I would go back to work, but I would probably start to feel the effects on like a Friday. So, quite often, I tell
Mm-hmm.
my clients that didn't really feel like peopling, you know, send me bits that you need me to do, I'll get it done. But I'd likely have been working from my bed. Or
Yeah.
from the sofa and just not really talking to anyone. Then the
Mm-hmm.
steroids wear off over the weekend, so you've kind of got the weekend to recover. And then I used to start to feel really rough on like a Monday, start to feel better on a Tuesday, and then back in for
And then it's
chemo on a
back on
Wednesday.
Wednesday.
And it was like this never-ending
Gosh.
cycle, and you're just exhausted.
Mm-hmm.
And then when I started, I think they call it Arubicin. I can't even, they call it the Red Devil. It's red. It's extremely
Yes.
harsh.
Mm-hmm.
And that stripped my body of everything. I then needed 2 blood transfusions because it just completely wiped me out.
Gosh.
Had to have the injections to try and keep my white blood cells doing what they needed to do, keep my
Mm-hmm.
neutrophils up and all of this malarkey. And that again was really, really, really tough. That was when I started to feel really exhausted. And I had really dark moments that I've, you know, been quite open about. I never I'm very grateful that I found my cancer. I'm very grateful that I'm here. I'm very grateful we found it in time.
Yeah.
But that when I was really unwell and so sick and so tired, I'd sit there and think, God, this would have been so much easier if I just didn't know about it and carried on life as normal. Because I was healthy before, I'd lost loads of weight, I was
Yeah.
active, I was running. And the thing about, in particular, the cancer that I had, because I wasn't having physical symptoms,
Yeah.
um, it felt like it was the drugs that were making me sick, not the
Yeah.
cancer. And I really
Mm-hmm.
resented the fact that
Of
these drugs
course.
were making me so damn sick. And so I did have really dark moments where I thought, well, if I didn't know, I would have been fine. I would have carried on and might have dropped down dead one day, but you know, I wouldn't be
Yeah.
feeling like I'm feeling
Wouldn't be
now.
feeling.
And that wasn't really rational thinking because, of course, they, without a doubt, my life has been saved by those
Mm-hmm.
drugs and feeling so crap for 6 months, you know, a year,
Yeah.
still sometimes now, 18 months down the road,
Mm-hmm.
will never, you know, the fact that I'm alive completely outweighs all of that.
Yeah. And it's so good that you know that you feel that way. That's excellent. But in the moments when you're feeling that unwell, it's
Mm,
hard to switch on the rational brain and be like, in a few months, like another day feeling like that feels like a lot.
yeah.
And also with that's the thing with a lot of cancers, there are, especially when you catch them like you did early before it was making you feel unwell and giving you symptoms,
Mm-hmm.
the treatment for it becomes the illness itself.
Yeah.
And then, like you were saying, you had, because of the white cells and everything, you had to take you know, things to keep your white cells up, because the drugs that you're doing, cancer is such an aggressive disease that to kill the cancer cells, you can't just attack those, it attacks everything. That's why you lose your
Everything.
hair. if your white cells drop and you get like a minor infection, you've got nothing in your body to fight it. That is a life-threatening illness
Mm-hmm.
that can come from trying to save your life from another life-threatening illness.
Yeah.
And it's just juggling all that and carrying all that with you. Absolutely, in those moments. And I'm sure people listening that have gone through similar diagnoses or experiences will know that those dark thoughts come. But
Mm-hmm.
I'm so glad that you shared that. Now being alive now
Yes.
is worth it.
Yeah, 100%, 100%. So yeah, we got through it. And I just wanted to I just was reminded of Easter 2021, where it's just before I had my first transfusion, and I couldn't figure out why I couldn't walk up the stairs. I was so breathless, I was so tired. And then I got a phone call from the nurse like, we'll see you tomorrow for your transfusion. I was like, what are you talking about? Because sometimes the systems don't catch up. So you're sitting there and someone
Yeah.
phone you and be like, right, you need to do this. And you're like, what? No one's told me about that.
Mm-hmm.
And just remembering how much better I felt after getting that blood, just rejuvenated.
Mm-hmm.
Oh,
Yeah.
but yeah.
The thing
So
is, I've
oh yeah.
had after I had my second daughter, it's not on the same level at all, but I had to have a blood transfusion. And I remember I was about to leave hospital. They had discharged me, and every time I stood up, the room span. I was like,
Mm.
and as the day was going on, I was like, I felt weaker and weaker and weaker. And then I asked them to see my blood test to see what my red cell count was. And they told me what it was, and it was like borderline. I lost a lot of blood, but it's borderline for needing a blood transfusion. And they're like, here's some iron tablets. And I was like, absolutely no. I was like, this blood test was taken yesterday. Like the blood test would have lagged because that's when I gave birth. You need to check it again. And basically, I spent hours like advocating to get this blood transfusion.
Mm.
And when I finally got it, they did the blood test at the same time to see what my blood count was then. It dropped like 20 more points since the one the day before. And I was like, guys, every time I stand up, I just felt like I was going to fall back down. I was like, you can't send me home with a baby like this. But then you have that blood transfusion and the difference that you
You can
feel.
feel it going up through your or down through your body as it's going, and it's like takes hours and hours, doesn't it?
Yeah.
But you just start to, by the end of it, they're like, your color is completely changed. You
Mm-hmm.
look healthier. I understand why vampires exist.
Yeah, listen, that stuff's good, isn't it? The
I
red stuff is good.
understand. I understand. I get it. I get it.
Yeah,
So yeah.
exactly.
Uh,
Okay. So with
mm,
all this happening, what okay, I've got so many questions, but the first one, in terms of your family, you were saying about how to tell your husband, how to talk
mm.
to your mom about what was going on, even broaching that with your daughter as well. How did you kind of navigate that part of it?
Yeah, I remember phoning Chris as soon as I got the information. So as soon as they told me, they were like, right, we're gonna need to do some blood tests and stuff. I was like, I need to phone my husband. So I
Mm-hmm.
phoned him and straight away was like, it's cancer. And I could just hear him break. And that broke me. But
Mm-hmm.
I was just in practical mode. I was like, it's gonna be okay. I relayed all the things that the doctor said. I hid the words like aggressive, fast growing, and were like
Mm-hmm.
small, early. And those were the words that I really, really clung to when talking to people.
Mm-hmm.
You know, apart from with Charlene and my mum. I
Yeah.
think even with my mum, I hid it a little bit, but Charlene was in that room with
Yeah,
me.
she
And I
was
know,
there.
yeah, she went home. I know she did all her Googles.
Mm-hmm.
And then, like I say, I came outside and my mum was there and I just kind of looked at her and she was very much like practical as well. And that helped me. The person I was really worried about telling was my sister. And I had this conversation. She's quite emotional sometimes. And I was like, oh, it's Tiana's birthday in 2 days. If I tell my sister before, is she going to get super emo about it all? And then I'm going to have to manage her emotions. But
Mm-hmm.
then if I tell her after, is she going to be angry that I didn't
Yeah.
tell her straight away? And that was my dilemma, like managing other people's emotions. And when you know someone and you know what their reaction might possibly be, like you can
Yeah.
take an educated guess. That is what I found really, really hard.
Mm-hmm.
I did tell her before, and she hats off to her. She took it like a trooper. I was very surprised.
Mm-hmm.
But just really every person that I told, and then also with Tiana, she was so tiny. We didn't expressly
Mm-hmm.
tell her, but she'd seen when I had a biopsy because I couldn't like sort of pick her up straight away and
Yeah.
things like that. And she's so inquisitive. She'd ask lots of questions. Mummy, where are you going? Are you going to hospital? So, yeah, mummy's going to the hospital. The doctor's looking after me. I found it really difficult that because I'm quite active.
Hmm.
Like we jump, we dance. I couldn't do any of that with her
Yeah.
as the treatment went on and I got more and more tired. And that was really hard for me. And so it was finding new ways to interact with her that made me feel like I was still being a mum and still looking
Yes.
after her and giving her what she needed, drawing and games and reading and just all the cuddles basically. Um, so that we didn't tell her specifically, but if she asked questions, I'd answer them as honestly as I could. Yeah. And then it was kind of telling the world because you know, I'm active on social media. I don't have a huge following or anything like that. But over the years, my different pockets, my PA people, my running people, all of those
Hmm.
people, my mum people, you know, they are used to seeing me on Instagram. And
Yes.
they're used to when I used to talk about having Tiana and how unwell I was then, they're used to seeing that. And
Hmm.
so for me, it didn't, one, it's not in my nature to kind of not talk about things. But if I just disappeared off social media, people are going to be like, huh, what's going on? And I've
Yeah.
got lots of friends and acquaintances who I may not see every day, but that's how we communicate.
Hmm.
So figuring out what I was going to put on social media as
Hmm.
well was quite difficult. In the end, I did a post that actually confused a lot of people because one of my really good friends decided to do a Christmas Day run for me and raise money for cancer research,
Hmm.
but my post kind of talked up what she was doing. And then there was this tiny little mention about me having breast cancer. And everyone's like, what? What's going on? What's happening? You've got, and then,
Hmm.
but that was the best way for me to kind of do it because I didn't want to do it and I knew that it was going to draw attention,
Yeah.
but I didn't want
Yeah.
attention. I wanted
Hmm.
attention.
Yeah.
So yeah. Um,
Okay.
I wanted people to know, but I didn't want it. I wanted it to be more about Lorna's doing this great thing rather than this is my cancer.
Hmm.
And
Okay.
yeah, that was quite difficult.
And then from what I saw that you shared quite a bit. Did that kind of just evolve naturally as you went through the journey? Did you make like a conscious decision that I was going to share this much and not share this, or
Mm.
did it just happen?
I I really do well with talking. So
Hmm.
when I'm upset, when I'm stressed, talking it out, if ever I'm looking for healing, it's talk therapy that I go for because that
Yes.
works really, really well for me. But what I didn't want to do was kind of burden my friends with it or
Mhm.
burden, those close to me. And I know that would never be the case. But I moaned a lot. It was hard. I moaned.
Yeah.
And so
Hmm.
for me, it felt really good to go on Instagram stories and have a good moan and have a good
Hmm.
bit of a cry if I needed to. I didn't open up half as much as I could have done. Like I kept a
Hmm.
lot of things back, but kind of sharing, what happens at making light of it, like, oh, here's what I ate at chemo today.
Yeah.
And, that kind of stuff made it a bit easier for me. It felt good to be a bit lighthearted about it. And then there were moments where it's really difficult and I would cry on the stories or I'd do an emotional post. And I know
Hmm.
that people wanted to know. And you know what you don't want to do? You don't want to send 800 messages to individual people
Yeah.
saying, and here's what we've got today, and here's what we've
Hmm.
got today. And it also helped because it meant that I was able to reach communities who are able to support me. Um,
Hmm.
you know, the Black Mums Up Front takeovers because I'm friends with one of the founders and she was like, would
Hmm.
you do it? And actually what became clear to me that we need to spread awareness for breast cancer,
Absolutely.
and sometimes that need to spread awareness trumps what's actually going on in our own lives. And actually I'm here, I'm living it, I'm experiencing it, so who better to talk about, one, how you can find it, and two, what goes on. Like I had no idea what happens when a person gets cancer.
No. No.
I had no idea. I had friends going through it who kept it very, very private, which is, I really salute them for. But I had no idea what happens what happens to your body, what happens with all these
Hmm.
hospital appointments, and actually breaking down some of those walls and those barriers so that other people can support their friends and their family, but also understand, how to advocate for themselves, what signs and symptoms to look for. It kind of just started to follow and come quite naturally, I think,
Yeah.
as well as being
And
a release for me.
Yeah, and the thing is, I know from when I saw you share those stories on Black Moms in Front, I felt like I had to follow you straight away. Um, and I know that people have gotten so much value from what you have shared. Whether it's about supporting somebody or knowing what to look for in themselves, and even me as a professional, seeing how to it's always nice seeing a patient's perspective when you're not as you as a doctor. So it's like being a
Mm.
fly on the wall, and it really helps to change the way in which you speak to your patients and just understand things better. And so honestly, what you shared has been really, really valuable to so many people. So thank you for always being so vulnerable.
Oh, thank you.
Um, well, I was just thinking if we could move on now then. So we
Mm.
spoke about the actual cancer journey.
Yeah.
When did you find out that, were you expecting this day, okay, once the radiotherapy or the surgery, whatever the last thing was, did you know that date was coming up? And how do you feel when you're coming up to that point of finding out, have the cancer been cleared up?
Yeah. So there were lots of checkpoints along the way, and I was fortunate to do a trial, an MRI trial, which meant I had like bi-monthly updates on what was happening with my tumor.
Okay.
So I knew that it was shrinking down. It
Mm-hmm.
disappeared very, very quickly, and I had chemo before surgery. So I knew that surgery being a lumpectomy was kind of to take away the remnants.
Yeah.
And about 2 weeks after that, I had an appointment, and they told me that they'd got all the cancer there. Like, so I
Mm-hmm.
knew after surgery that they'd got all the cancer. The radiotherapy was kind of belts and braces to really make
Yes.
sure it was all gone. And that again was horrific, but we got through it. It was 2 weeks. Was it 2 weeks, 2 or 3 weeks, and then
Mm-hmm.
it was done. And then I had an appointment after that where they're like, okay, so that's it now, you're done. We don't need to do anything else. I was like, oh, that's it. Nothing else. They were like, yep,
We're
that's
finished.
it. If you feel unwell, come back to us. So that was end of September 2021, where I was
Mm-hmm.
kind of like, okay, so now I have to rebuild.
Mm-hmm.
Now we're done. They're saying I don't have cancer anymore. I say that because recurrence rates of triple negative are very high,
Mm-hmm.
especially in the first 5 years. And the one thing that's always kind of grated me is that they didn't do any final scans. They were like, we got it all out of surgery, so we know. And I was like, okay, we
And
don't
they
want to
didn't
check
scan you
anywhere else.
again.
No. And that's because I was, in my particular hospital, that's their protocol. And I've
Mm-hmm.
always felt a bit like, so how do we really know it's gone? We don't, do
Yeah.
we? And that's always a risk. I think lots of hospitals don't use the term remission anymore. I'm no
Mm-hmm.
evidence of disease. They could find no
Yeah.
evidence of disease. It doesn't mean it's not there, but we live life like it's not there
Yes.
because otherwise,
There's
we're
no
constantly,
evidence. If there's no
yeah,
evidence, you can't change anything. So that you work with what you know. And so
cannot
it's
change
not
anything.
there.
Work with what we know. Exactly that. And the advice was if I feel unwell, to go back. If I find any new lumps, to go back. But effectively, go live your life, girl.
Mm-hmm. And so how has that been living your life post this? So it's 2023 now. It's been
Mm,
nearly 2 years. So
yeah.
a year and a half since, well, just over that, since hearing that news and being like, go forth and
It's been
recover.
hard. Yeah, it's been really, really hard. My health anxiety is constantly on high alert. Um, my mental health has been extremely low, and I think the months after that, I was just I don't know how I was getting along.
Yeah.
Um, and then I suffered the loss of one of my best friends from cancer, and that was again horrific because we was being treated at the same time for different cancers, and just
Yeah.
I found myself last summer in a very, very, very low place, a very low place, and not knowing how I was going to get out of it. And during my treatment, I had counselling, I had talk therapy, which sort of helped a little bit. I don't think it was the best match with a counsellor. But I then was like, I need to get some help, otherwise, we're going to have a real problem here. I
Mm-hmm.
was I was just exhausted. And I also found out I had an underactive thyroid, which I think is a result of the radiotherapy that I had to my throat, because I had it like up the top of my chest and my throat. So I was exhausted again, very, very tired, very anxious, and trying to lose the weight that I'd put on, trying to get
Mm-hmm.
healthy and strong, having gone from being a regular um exerciser. I found myself very, very low, like lower than I felt for years. Very different to my postnatal depression where I was like catastrophizing and like the world's going to
Mm-hmm.
explode. I just felt like I couldn't really cope. And a lot of that, I think some of it was doing my underactive thyroid and being so tired and so lethargic from that, and just really low mood. So I went through IAPS and got some counselling, which
Okay.
helped. But I think I also, like, something switched on in my brain. So what my friend who passed away said, she took her journey very, very privately. But the one thing that she was always super duper clear on was how proud of me she was. And how it was at that point that I kind of started getting involved in some of the campaigns and things like that.
Okay.
And just her messages about doing my best, living my best life, being
Mm-hmm.
happy, were what kind of started me to feel like, okay, you have to come out of this. You have to get better. Like, you have to get mentally well. You have to get
Yes.
mentally strong, because you survived cancer, and you're not going
Mm-hmm.
to go down due to depression. You're not going to go down due to sadness.
Mm-hmm.
Um, so I had to really work hard to pull myself up out of that hole, and like start going to the gym again, and really start sleeping right and taking care of myself. And I guess also being a bit selfish. The one thing that I am is very much a doer, and some of that's to my own detriment. I
Yeah.
should have taken time off. I only took a week off after surgery for that cancer.
Really?
I only took a week off.
Mm,
I should have taken proper time off. I could afford to do it. The
yeah.
business had people in it at that point. So I never really stopped. I never stopped really and asked for help,
Mm-hmm.
big help, or there wasn't anybody who told me, Leanne, you need to stop, you need to take a break, you need to be easy on yourself. Not really, people
Yeah.
just kind of let me get on with it. And maybe because the
Mm-hmm.
people closest to me were like, she's just working through it. I
Yeah.
suspect I was probably quite manic with some of the
Mm-hmm.
way I was just like, no, got to keep going, got to keep going. But I was just so used to doing everything, so used to doing it
Yeah.
all and not stopping. And how am I going to reach my goals if I stop? And I'm not from the school of you can sleep when you're dead, because
Mm-hmm.
me, I love at 8 hours.
Yeah.
But it was like, I I can't go through all this and then just break. And so I was
Yeah.
pushing and pushing and pushing, but actually I was
Mm-hmm.
pushing myself towards breaking.
Yeah.
So summer last year, I was like, this is it now. This is about me. I need to get happy. I need to get in the best place that I can be. I need to
Mm-hmm.
be selfish. I need to set boundaries. I need to not take the things that are making me unhappy. And I need
Mm-hmm.
to work through all the trauma. Mm.
Yeah. And so what did that look like then for you? What things did you change? I heard you saying about getting out and going to the gym, and we sought some more therapy. What did that what does that practically look like for you, kind of bringing yourself out of that? It sounds like you made a choice. The first step was making that choice to do that. And then
Yeah.
what happened next?
Um, and I think it's really also really easy to say I did make a choice, but I
Mm-hmm.
was at that point I was still strong enough to make a choice,
Yeah.
because sometimes when people, I say it often, sometimes when people are very, very down or in very dark places, it's not as simple as being like, right, and today I'm going to turn things around. They have to be ready
Mm-hmm.
to do that. And I just think that I got to the point where it's like, I can't do this anymore. And I was fortunate enough that I had the tools within my
Mm-hmm.
box to kind of seek that help.
Mm-hmm.
Um, but it's little things like putting myself first a bit more.
Mm-hmm.
And I think not seeing many of my friends for much longer than most people did, because I was in treatment and had to shield for half of
Yeah.
it. So when the world started opening up again, I was still inside and whatnot. But just starting to like enjoy myself,
Yeah.
just not being like, well, I'm not going to go out. I'm not going like seeing my friends, having a good time,
Mm-hmm.
doing the things that bring me joy, going and getting spa treatments, looking
Mm-hmm.
after myself. And I felt like I'd lost so much of my shine and my sparkle. And all of a sudden I woke up and was like, I can be the baddest bleep I want to be.
Yeah.
I can I needed to get back to believing that I could do anything. That's how I used to,
Absolutely.
I've won awards, I've run marathons, I've given
Mm-hmm.
birth, I've done so many amazing things. And
Mm-hmm.
I'd sort of forgotten that that person existed.
Mm-hmm.
And so it's like, well, I can do that and even more. I can do all of that stuff and even more.
Yeah.
And it might mean that I have to say no to the things that are bringing me down. It might mean that I have to be firm. It might mean that I have to cut some people away. But what's
Mm-hmm.
most important now is that I am happy, so that my daughter can be happy, and so that we
Mm-hmm.
can live our best lives possible. I don't know
Yeah.
how long I've got left in this world. And that's what became abundantly clear to me with that diagnosis.
Yeah.
That if I didn't know, you know, given it had spread quite far into my armpit, who knows? Who knows what would have happened if I didn't go to the doctors within a few days? Who knows if I'd left it until the new year?
Yeah.
And so I can't sit here and risk being miserable. So if I'm miserable, I'm going to see a therapist. If I need to go on medication, I'm going to get on medication. If something's hurting, I'm going to go to the doctors, because I cannot afford to be in a situation where I'm not living my best, healthiest, strongest life.
Yeah. Excellent. And that's the thing, what you said as well about making that choice, and you have the ability, you have the toolkit to make the choice. Sometimes we don't have that. And sometimes we have to, people around us sometimes have to be the ones to push us to and see that we're in a state where we can't do that. I think there's a lot out there that, you know, stigma against taking medication when you're depressed, everything. But sometimes the medication is what gives you the ability to then make the choice to do the other things. And so there's so many different ways to do it, and the ways that it will look, choosing yourself or choosing to be happy. But you've got to take the time to figure out what that looks like for you, and making, you know, you might choose one way to do it and that wasn't the right way, then trying something else. But just moving forward and doing something for yourself is really important. And I think what you said about being selfish, there's always these negative connotations to that word about being selfish, but it's important because there's only one of you, and and if you want to be able to serve those people, like you said, about living your best life, caring for your daughter, being able to show up the way that you show up, if you don't look after yourself, like you said you beat cancer, but you're going to let depression get you. Like, you've got to look after yourself. You have to be selfish to then be able to give. And so, yeah, I'm so glad that you have made that choice, and that you're starting to live your best life, and, you know, have these realizations, and you're living in the way that you're living now. It's amazing to see. Thank you so much for being so honest, so open, sharing so much with us this evening. I would love to have you on the channel again sometime, because I know there's honestly so many things.
So much to say.
I so much like valuable things to say, so much value to give people, but I know that time is running out, and I don't want to keep all you listeners here for the next 3 hours. And so I hope you enjoyed this conversation. I really did. Would you let everybody know where you can be followed, where we can find you?
Yeah, of course. So I am on social media. You can follow me at Leeanne Adu _ on Instagram. Connect with me on LinkedIn if that's your jam. Or everything is Leeanne Adu, LEEANNE Adu ADU, and you'll find me. So yeah, I'm there. And I love hearing from amazing people and hearing other people's amazing stories, and just
Brilliant. So thank you all for listening. Thank you for watching. Thank you, Leeanne, again for coming on. And if you've enjoyed, don't forget to rate and review this on Apple Podcasts. Don't forget to subscribe. You can find us on Instagram at Life with Dr. Amanda. I'm on YouTube. Sorry, let me say that again. You can find me on YouTube at Life with Dr. Amanda, same as my Instagram handle. And on Apple and Spotify podcast, it is De-Stress with Dr. Amanda. And I hope you enjoyed this conversation. We have lots more amazing guests coming on, so I hope you stay tuned.